Hey George, how are you doing?
Hey Erin, how's it going? I'm doing good, doing good. Excited to have another episode here today.
Me too, me too. We have some really nice special guests. So today we have with us Dr. Peter Bongiorno, and we have Dr. Jacques Jospitre. I'll give a short little introduction so you can know a little bit about each of them, and then we'll dive right in. We have some great questions for you guys today. So Dr. Bongiorno, he's a naturopathic doctor practicing medicine and naturopathic medicine. He has done 5 years of training in naturopathic medicine and acupuncture, and his mission is to improve health of his patients by using the most natural means possible and change the model of healthcare in the process. He's helped to create the first elective natural and integrative medicine class at the Mount Sinai School of Medicine and is an adjunct member, faculty member at the New York University and at the Natural Gourmet Institute for Food and Health. And as a hobby, he's a drummer. And Dr. Jacques Jospitre, we're happy to have you back on the show. Dr. Jospitre was on our first episode of Beyond the Therapy Session because he is one of the founding partners of SohoMD. So we welcome you back, and you can reference that first episode to know a little bit more about the inception of SohoMD. But Dr. J, in his practice, he likes to look at the whole person when addressing their mental health. He uses DNA in his protocols to evaluate patients. And he also uses visualization and dream analysis in treating patients, and also has an MBA and knows computer languages, including C++. So he has a wide variety of talents. So I'd like to welcome you both today. Thank you so much for coming on the show.
Yeah, thanks for having us.
Thank you.
And so to dive right in, we would like to know, how did your paths cross? Dr. Bongiorno, you're a naturopathic doctor, and Dr. Jospitre, you are a psychiatrist in modern medicine. So how is it that your guys' paths crossed?
Well, it started, maybe, was it 5 years ago, roughly?
I think 5 or 6 years ago.
Yeah, 5 or 6 years ago. It started with a couple patients where I was having a lot of trouble figuring out what was wrong with them. I did everything in the protocols. I did everything I'd been taught, everything I'd learned, and they just wouldn't get better. And then I started exploring, what was I missing? What could I do to help them? And then it turned out that there's this whole thing with, looking at MTHFR and all these other things you could do, and people had these solutions and these protocols around that. And then that kind of started me down the rabbit hole of, let's see what this thing really is. And then as I started digging deeper, I found that there was a conference about this whole area of integrated health and psychiatry, which was IMMH. And so that was my entry point for getting into this world of functional medicine. And it was at that conference that Peter was one of the presenters, and that's how we first crossed paths.
Yeah, I remember, was I speaking on mitochondrial health?
I think so.
I believe so. Right. And we spoke after my presentation, and when we hit it off a bit. I remember going out to dinner and then going to buy cowboy hats and for our for our children. It was in Dallas was the conference, right? So I always like to get something for my daughter when I go away. And so he and I went to a store to pick up a nice pink cowboy hat and boots for my daughter.
That's so funny. Thank you so much. And so I'm actually curious to know a little bit more about some of the terms. So you mentioned integrative medicine, functional medicine. I do believe that most people understand a psychiatrist, but maybe naturopathic doctors new. Would you guys be able to explain some of those terms so we can know more?
So a functional medicine doctor, that's one of the first terms you mentioned. A functional medicine doctor is a medical doctor that goes through conventional medical school, excuse me, and then after school typically starts looking for other holistic means and what we call functional solutions. And the word functional, I think, comes from the idea that there's an organic quality to why people have illness, and then there's a functional quality, meaning that organically things seems to be structurally fine, but they're just not working well as a whole, as a physiology. And so functional medicine, and the term was coined, I believe, by Jeffrey Bland in the 1990s. And functional medicine actually, I believe, was the brainchild of Jeff Bland and Joe Pizzorno. Joe Pizzorno is a naturopathic doctor who started Bastyr University in Seattle and is a well-known doctor in his own right. And he and Jeff Bland were friends and talked about this idea of how could we change medicine? How could we have conventional medical doctors learn a more holistic approach? And because at the time, Joe Pizzorno was leading Bastyr University, which was at the time the second naturopathic medical college in the country. But there was no training for conventional medical doctors to learn a more naturopathic and natural medicine approach. And so that's how functional medicine was born.
Yeah, and let me add to that. So there was a change in technology, which is now leading to a convergence of the two areas, and that change is genomics, right? So before genomics, we could walk into the room and you could have you do symptom assessment, and then you can do things, looking from a naturopathic side or the allopathic side based on the symptoms. With the allopathic side, we have the labs that we're doing, and it wasn't clear how do you incorporate the two into one. And so with genomics, now it became so cost effective to look at variations of your physiology, your biochemistry that are unique to you that can now correlate to whatever symptoms you have. So then that started putting in the groundwork for the pieces that are connecting the two areas where it wasn't possible before. And I think that's why there was this huge gap between the two worlds. But we're seeing now that enough new technology and enough advancements have happened that we can now smartly and scientifically put solutions together for people based off their unique biochemical and physiological patterns in their genes. And again, it's early on, but the framework is there for it.
So when I'm hearing a bit of, with functional medicine, it's kind of like a mix of some old school medical traditions and ideologies mixed with, some of the new scientific advancements that have been made. And you guys are tying genomics in to kind of pinpoint and figure out specific areas where maybe old school medicine wouldn't have been able to pinpoint, but they still had that idea.
Exactly. And I think what happened before is, I don't know why there's always been this huge gap, because you figure as a physician, you want to use all the tools to help a person feel better. And part of the tools is understanding what works naturally in the person's body and supporting that. And then places where, things aren't working, that's where medication fits in. So everything has a role. And there's no reason that if you care about the overall quality of your patient's life, that you wouldn't want to look at all the tools in the toolbox to help patients get better.
Yeah, I was going to say, it sounds like from the way you described it, that it's almost like these two existed separately, and there was no overlap or like discussion of overlap between naturopathic medicine and allopathic medicine. But now more recently, and you said it's very new, it's merging. Is there any like conflict between the natural world and the allopathic world, or how are you seeing that blending?
Well, I think that depends on a particular person's ideology. I don't see conflict. I see a lot of coherence, and I see a lot of flow going on. From a naturopathic perspective, I remember learning 25 years ago, how natural food, vegetables, fruits, and things were good for your body, right? And I remember learning at the time that those foods had information in them, and that information went to our body and gave our body good information, almost the way you feed a computer good information to have a computer run efficiently. Now, with all the tools we have and learning about genetics and genomics and metabolomics and proteomics and all of these omics, what we're learning are how these substances get into our body and affect change. It can affect receptors. It can affect what goes on in our DNA, what DNA gets expressed, what DNA doesn't get expressed. So now I think it's taking it to a much higher level. So in my opinion, there are still people out there who are very religious about what they've learned in the past. And I think if they stick to that in a more religious way, then they might miss this boat of connecting these medicines so beautifully. But a number of years ago when I met Dr. J, I was excited to meet him because he was one of those forward thinkers who had learned the conventional medicine at a very high level and realized that this kind of medicine would bring it even further. And that's exciting.
Yeah, what's interesting also about Peter is this background also doing research at the NIH. So he has a deep background in the scientific approach to medicine and healthcare. And so I think we both share that common philosophy of combining everything and really having a logical framework around why we do the things we do or why we make the choices we make. And it really all fits together. And I think for those of us who see this where it's so clear, there is no conflict. It all blends beautifully. And from an allopathic side, I mean, everything we learned in biochemistry and physiology, that's the foundation, or even nutrition, that's the foundation of a lot of the work. So we're taught it, but it's kind of minimized in the training. And the point is to kind of bring it back out. So it's not reinventing the wheel. It's just saying, hey, you might have had a 1 month or 2 month course in this, but maybe you should have, there's a lot more to it than what you learned back then.
Yeah, that's really helpful. Thank you. And that kind of leads me to my next question of, so we're looking at psychiatry and functional medicine. What is the relationship between those specific specialties?
Yes. So the steps that SohoMD has taken so far, they're just basic little things that typically aren't done. Like looking at doing extensive labs, just the basic detailed labs, looking at hormonal issues and endocrine issues or hormonal issues, and also nutritional issues, and really incorporating that information into the treatment of patients. So that's been the first step that we've already been implementing, which is really just an extension of a thorough standard protocol. So even that is taking a couple steps in the integrated functional realm.
Yeah, it's really understanding that when you look at a condition, a mental health condition, that and you see depression or you see anxiety, what you're seeing is really the tip of the iceberg. And you can look at that symptom and say, well, you know what? This person has depression, give them this particular drug. And it may or may not help the symptoms, but what you're not doing is really looking under the hood at the underlying causes. And this is what we're suggesting, is that in mental health, there's multiple underlying factors that are participating in why this person has this condition we're calling depression. And if we can look at, what's going on with their nutrients, what's going on genomically, what's happening hormonally, is there a lot of inflammation in their body? What's their gut health like? All of these things are going to play such a strong role in why the brain is going to shift and why behavior is going to shift. And the more of those things we can understand, the better we can make decisions to help that patient get back in balance.
Well, that's very interesting. And, I'm a nurse practitioner myself, so I know the answer to my following question, but I want to pose it to you. So inflammation and gut health are connected to your mind?
Yeah, absolutely.
Tell us more, because that sounds new.
Yeah, Peter, you want to take that one?
Yeah, so there's a very strong relationship between the digestive tract and the brain. In fact, there's exploding research about the microbiota, the bacteria in our gut, and how that transforms gut function and creates all of these different molecules like peptides, neuropeptides, neurotransmitters, and other inflammatory molecules, cytokines, and how those can travel to the brain and basically change what goes on in the brain. And then there's a nerve called the vagus nerve, which monitors a lot of that activity that goes on in the gut, and it actually sends signals to the brain that actually the brain makes changes as well. So there's this very strong bidirectional relationship between what goes on in the brain and what goes on in the gut. So for example, if there's a lot of inflammation in the digestive tract, that's going to change function in places in the brain. Let's say the amygdala, which is a fear center, or an area called the hypothalamic pituitary adrenal axis, which is where the immune system, the nervous system, and the hormonal system kind of all share information and talk to each other, and the brain then makes decisions about what the body is going to be doing from there. So it's a very, very strong relationship. And I've seen clinically with patients, when you can help the digestion, you can improve mood.
That's
I
pretty
need some
amazing.
tips on that because sometimes my moods get a little, up and down. So we'll talk offline about that, though, Dr. Bongiorno. I think it's very evident that you guys take, very holistic approaches as well. And at what point do you guys use pharmacology in order to further treat a patient in certain situations?
From the get-go. So all the symptoms like the depression, anxiety, attention, all those things are like the temperature. So when you talk about the temperature of like water, right? What is temperature? Temperature is all the molecules moving in different directions at different speeds. That's what temperature is. So there's one number, there's one thing that summarizes all those little activities going on, even though it could be, in different versions of it, but it's still those same common things. So when you see someone who's depressed, we don't throw out everything in psychopharm. We still follow the same standard guidelines around depression. You're still going to get, an SSRI, whatever medication we think needs to be addressed will happen acutely according to the guidelines. But at the same time, we're going to drill down and say, what's causing this top line? What's causing this emotion? What's causing this feeling, right? And then in the drilling down, we're going to look at, again, endocrine issues, nutritional issues. And so we do it simultaneously. So we try to help you feel better right now today, and then try to build things up from the bottom up of understanding what caused it, try to alleviate it, and then see where the balance is between the two. Some people will need medication indefinitely, just like some people need glasses, right? You might need vitamin A for your vision to work properly, but you still might need glasses. You might need both, right? And so one doesn't negate the other.
And I'm curious as to what role you guys think supplements also play into the bigger picture as well. Is that something you guys often recommend?
Well, I think so when you come up with a plan to help, we look at all the labs and we try to understand physiologically what's going on, where the imbalances are, and then you create a plan. And usually it starts with sleep, getting people to move their body, relaxation work, oftentimes psychotherapy, of course, changing foods, and then using supplements. So I think all of those things in combination probably creates the best effect than, let's say, just using supplements alone or getting someone to exercise alone or just doing psychotherapy by itself. And then the supplements themselves, at least the way I look at it, is they're very useful when we understand where the imbalances are. Let's say someone, we look hormonally and estrogen levels are very high. Well, there are some supplements which are very helpful to rebalance estrogen or balance estrogen to progesterone ratios. And that might be useful for that particular patient. Very simplistically, someone might have extremely low vitamin D. And then we know we want to bring vitamin D up. If someone's vitamin D was already normal, there probably wouldn't be much of a reason to give them more vitamin D. So we can use the laboratory tests that we look at as a really helpful guide to figure out which supplements might be most useful for that particular person.
And we should also remember that, medications came from supplements. They came from nature. And scientists refined what they discovered. What was the active ingredient in any particular bark or plant or whatever? And that's what we turned into a medication, that isolated component that was then optimized to have a desired effect. And so we can give supplements in the same way that you give medication to address things in a very general way. Just like aspirin could be used to decrease pain, but if the pain is caused by a sprained joint, a sprained ankle versus an infection, you've taken care of the pain in the short run, but you need to get to what's that underlying issue. Do you need to give antibiotics or do you need to do physical therapy, right? Which of the ones are involved? And that's why even with supplements, you still want to approach it in a smart way. So there are things that will mask whatever's going on and help you feel better. but there are other ways of using it more strategically once you get into what you find the source of the problem to be. So we think of medication and supplements in that similar fashion.
Yeah, and that's the key when it comes to psychiatry, and I think medicine in general, and I think that's what's so special here is that it's not just about giving a supplement or giving a medication and covering up a symptom, but it's using those things judiciously, to help a person feel better, and then really looking at, well, what's the underlying cause, and then how can we really heal and balance that. And I think that's the big difference, because I think right now, the way medicine is being practiced, medications are used symptomatically, but the underlying issues aren't really being looked into.
Dr. Bongiorno, I want to allude to something you mentioned earlier. You guys are medical doctors, many, many years of schooling. And for the most part, many times I would say that, they follow their schooling and tradition religiously. Was there a moment of realization, a particular interaction where you guys, this goes to either one of you, but was there like a particular moment where you realized like, hey, there's a particular part that's not being explored and talked about enough, and that's ultimately what got you guys to this point?
Well, actually, we have probably a different experience. I went to a naturopathic school, so I'm a naturopathic doctor. And actually, when I was doing research at NIH, I was planning on going to conventional medical school, and in that process, I had a friend of mine who was diagnosed with multiple sclerosis, and she had what was considered the chronic progressive kind. And her doctors are basically telling her, go get a wheelchair while you can. We were both about 23 years old at the time, and there didn't seem to be much hope. And through someone she knew, she ended up going to this naturopathic doctor, which at the time I thought was quackery. I had no interest in natural medicine whatsoever. I was going to go to conventional medical school. I was going to get an MD and a PhD, but I started seeing her get better. And I actually went to one of the appointments with her, and the doctor, this naturopath, said, you work at NIH, why don't you go look up some of these things? There's information about diet and MS. And I remember finding this study by this fellow named Swank. It was a 40-year study from the late 40s until the early 80s. And he gave patients with multiple sclerosis either conventional care, or he had them eat a much lower saturated fat diet and gave them, I think, some B vitamins or something at the time. And he found much lower exacerbation rates in the patients who had the lower saturated, higher polyunsaturated or healthy fat diet. And that was my aha moment. And I remember reading this thinking, gosh, why weren't neurologists talking about this? This seemed pretty solid. And so as I looked into it more, I got very excited about naturopathic medicine. So I ended up going to a naturopathic medical school, where these kinds of ideas are brought to you from the first day. And so, which might be a different experience from yours, Jacques.
Yeah. And for me with allopathic medical school, that was, the standard convention. That was the direction. I also started off as an MD PhD, thinking one day I'd be running a biotech firm or something. So that was the path that I saw myself on. And what really, opened it up to other approaches and solutions was, again, the patients. Just like, Peter felt compelled by seeing a patient get better. For me, it was about patients I was treating using, standard protocols that were not getting better, and I didn't have a solution, and I was in search of a solution. What could I do that would solve the problem? Because it just didn't make sense. It wasn't, and I didn't want to give up on them. And so in that pursuit, I learned about these other aspects and these other approaches, which blend in to what I had already learned. And I think that's what's so key. I think so many people take it, religiously, where they're really wedded to this particular approach and this is it, and their minds are closed to saying, let's prioritize the needs of the patient and let's see what we can do for them, versus this is the way we do it. This is the way you have to do it. This is the only way. And when you do that, that's not even scientific. You have to look at all evidence, all data, right? If you start closing things off for arbitrary reasons, that is not part of the scientific inquiry and approach. It's being open to what you observe, seeing what works, seeing what the data tells you, doing your best to interpret it, and so that's that thinking and that open-mindedness is what led me to explore these other areas. And again, it doesn't discount anything. All the stuff I learned before is incredibly valuable and still applicable, but it's part of a much bigger story and a bigger picture that we're trying to tell.
Yeah, well
Yeah,
said.
great.
It's I had a mentor of mine who once said, it's okay to be skeptical. And I am, coming from a research background, I'm always skeptical about natural medicines. I want to know that this works and this is bona fide. And it's not just something I want to believe. But as far as being skeptical, you want to stay curious. You want to stay open-minded, and you want to make sure you're learning, and that's really the key, staying curious.
Yeah, it's
Yeah,
really
well
cool.
said.
Yeah, thank you guys. There's one other aspect of this process that stuck out to me. You guys had mentioned like maybe diet and lifestyle changes, which I know can be tough for people, patients. I'm curious, like I'm kind of picturing myself walking into your office or virtually walking into your office and, maybe fearing like, oh, am I going to have to change the way I do everything in order to feel better? Or how might that look like for a person?
Yeah,
That's difficult.
there's a Japanese word actually recently learned called kaizen, and it refers to this idea that you don't take everything on at once. You have to take it in small steps. And when I work with a patient, and we spend an hour and a half together at the first visit, I'll get a sense of at what level are they ready to make changes. And some people really are ready to make large changes. So if you ask them to change what they're eating, they're ready to do it. But most of us, we need to do it in smaller steps. And so the key is to get to know the patient and know, first of all, what is their schedule? What is their routine? What are their preferences? What's their culture? What are their rituals? What are the rituals they hold dear? And to try to understand them and then work within that to start to make changes that'll, bring in more health. So for one patient, a first visit, it could just be bringing in more water, or they don't really like the taste of water. So coming up with something that's healthy that they would like the taste of, maybe hibiscus tea, so it could be something that simple just to get started. And then from there, little by little, you create more and more steps and make those changes.
And to add to that further, there are different aspects to it, right? So if you're depressed or you're anxious, that can get in the way of change.
Yeah.
If you have a history of trauma from early childhood that create emotional barriers, that could get in the way of change. If you have financial constraints where you don't have access to certain resources, that can get in the way of change. And that's why looking at these different perspectives on the person's life, trying to really conceptualize how they got where they are, why they might stay stuck, and then coming up with a solution that could be anything from those supplements that boost your energy, medications that help you feel less depressed, or therapy that addresses your trauma from childhood. All those different things, all used together, is what can help the person really make lifelong, lasting change. It's multifactorial, and the approach, it's a multi-prong approach to getting the person to that next step. And that's why the therapy part is so important. That's why it's just the biologist that's the beginning, but therapists who can dive in and do, like all those different things, you need to do all of them to move the needle, to move people forward.
Yeah, that makes a lot of sense. How long might a person expect until they start to feel better?
And that's all over the place.
Okay.
Some people it could be real quick. Other people it could be long time. And that we're exploring this, right? So I'm laying out some theoretical models of the optimal way to do it. Devil's in the details to making this work, and for each person, we don't make promises that we can't keep. We have this approach. This is the approach that gets us to help people improve their lives, but we will make you better. All the things we're doing are designed to make you better. We don't know how far and how fast you'll get to where you want to go. That's a unique process.
Yeah, no, that I think that's true. There's no one track and time frame that you can apply to all patients. I do know when people get better, it's typically also incremental, and you'll see a day or two, and people start to, they'll have moments when they're improved, and then they kind of slip back, and then they'll have maybe a day here and there, and then it slips back, and then a day or two here and there, and that's what I typically see as real improvement and moving in the right direction. It's very rare you'll see someone who just one day they'll wake up and okay, it's all better. It happens occasionally, but it's usually a slower process, and that's the process I trust when I see those small changes. And then usually if people slip back a little bit, that's often an opportunity to say, okay, well, what's been going on that last day or two that you kind of felt that movement backwards, because then you can sometimes identify other factors that maybe we didn't know about. Maybe it could be a food, maybe it could be they didn't eat for a couple of hours, or it could be a time of the month in terms of a hormonal change or something like that. And so I often find when people slip back a little, that can be an opportunity to say, okay, well, what haven't we uncovered? What didn't we figure out that now we can learn from, since we cleared a few other factors already?
And one thing to add to that, or a couple things to add to that, is I think that's where triggers are so important, right? So the people you have in your life and the environment that you're in has been constructed based on who you've been. So as you change as a person, both the people and your environment have to change to sustain the new you. And one of the hard parts is making those modifications external to you to help reinforce that internal version of you, where the old triggers will get you to revert back to your old behaviors. And that's why, people talk about with substance use, especially with people, persons, and things like that you need to make those modifications. It's true in general for anything you do. And so that, I think, is part of the delay that people will sometimes have in making improvements in their lives, is making those modifications.
Yeah, that's actually really powerful. That resonates a lot, and it sounds like too that this is a healing journey. Like there's I don't know if it's a permanence, but there's like real practical steps forward in terms of somebody's overall health. Whereas, coming from a traditional psychiatry training, it's about symptom exacerbation and relapse, and maybe they get better, maybe they don't, and they just always address the symptoms. So this, just like the overall picture and projection, seems like this is long term. It's healing, and I'm assuming there's some kind of like permanence to that. Maybe you can speak to that a little bit. What like healing might look like for a person.
From my perspective, healing looks like a person who's on the path to achieving their dreams and their purpose in life. Each of us is given so much time. Just like glasses brings visual clarity to you, where you can see where you're going. Our goal is to promote mental clarity, so a person can choose the path that makes sense and is consistent with them, and help them see the steps to really pursue and achieve it. And if we do that for each person, where we help each person pursue and achieve their dreams, we've done great work. We've done something worthwhile. And that's the larger vision of what we're trying to accomplish.
Dr. J, you mentioned with triggers and, kind of getting back into certain habits or, acting a certain type of way. Triggers is a big thing for myself as I try to like improve my life and, what I'm able to accomplish. And, in order for myself to identify certain triggers, I often like use forms of meditation to try to reflect on myself. Is that something that you guys often recommend, or do you see that there can be pluses to practicing some sort of meditation?
Yeah, mindfulness work is definitely important. Connecting with your deeper self, having clarity on what you're really feeling and what you're thinking. And when you have stillness, you can get to that voice. And with that voice, if you follow that internal guidance, I think it takes people down their proper path in life. I think it helps them connect in a way that's deep and meaningful, and helps them find, that their time is really worthwhile in terms of how it's spent.
Yeah, and even from a more scientific standpoint, when we look at the research on meditation and deep breathing, I mean, what it does for vagal nerve tone, and what it does for calming our hypothalamic pituitary adrenal axis, right, our stress system, how it brings blood supply back to the digestive tract, which helps us digest our food, which is going to work on the underlying causes. So at every level, good meditation and that kind of mindfulness-based work is absolutely important.
I just want to give a quick shout out to Marsha. She's the producer of Beyond the Therapy Session. She has showed me great breathing techniques, and that's something that she's also very, she showed me a lot of that. So just a little shout out to Marsha. She's very essential in making, this podcast happen.
Go, Marsha.
So Erin, I don't know. I think now's a good time to maybe get some final points, thoughts, maybe some closing statements. If you guys have any good tips or just a general, idea you want to get out to the listeners.
I think what is interesting is there's so much information out there. There's so much information on everything. All these different perspectives and approaches to care and to treatment have always existed. I may have found it recently, but it's out there. It's endless amounts of information. But what there also is there's also a lot of noise. And our challenge today is not so much, whether or not something even exists. It's whether or not you can find it, because there's so many distractions that take you away from the truth or from the better sources of information. And what I would say for people is, if you have challenges, you have problems, go out there and look for solutions, realizing that it's out there somewhere. There are answers to your questions, to many of your questions. You just have to make your way through the distractions and the noise to get to the real sources of good answers.
And if I could add to that, I would say sometimes it takes a few tries, and you have to really listen to your intuition and what you think is right and who you think you're harmonizing with when you work with them, and just don't give up, because the answer is out there, and it might take 1 or 2 or 3 or 4 tries, but it is out there, and you're absolutely worth it. So keep working on that.
Such a nice episode today. I'm so happy to have you both here on our podcast, Dr. Bongiorno and Dr. Jospitre. I hope everybody listening was able to get a few good nuggets of wisdom. I think this is definitely the future of healthcare and mental health care. So I just really appreciate you both providing some insights and deeper understanding of these medical practices. Thank you so much for joining us.
Yeah, thanks for having us.
That was a pleasure. Thank you.
Thank you, guys. Really appreciate it.